All right, so it's 7:30, so let's get started. Oh, all right. So tonight we're going to talk a little bit about the physical preparation for pregnancy and delivery. Whether you know someone that's pregnant, you're pregnant yourself, physical preparation for pregnancy and delivery is really important. So that's why the Maternal Health Network of San Bernardino County has worked together with subject matter experts in San Bernardino County to discuss the three most important things that families need to know about physical preparation for pregnancy and delivery. And this information was used to inform this presentation today. So my name is Dr. Emily Rule. I am a pelvic floor physical therapist. I own Wings Physiotherapy. It's up in Apple Valley, California, and we specialize in basically all pelvic health, but a good majority of our patients are either prenatal or postpartum. So we hope that by the end of this presentation that you will learn about these three things. So preparing to get pregnant and things to consider as you prepare to conceive, things while you're pregnant, how to physically take care of your body for a healthy pregnancy, and then getting ready to have a baby and accessing information and resources to help plan for labor and delivery. So there's a lot of information about pregnancy and delivery out there, but for this presentation, this information has been synthesized into those three main points that subject matter experts agree are the most important things that we need to know, including what it is, why it's important for mom and baby, and what the process of physical preparation for pregnancy and delivery entails. So we're going to go over those 3 points, and then at the end, I'm going to provide you with some resources on where you can go for support, especially within our county. So when trying to get pregnant, it's easiest to conceive 10 to 14 days after the first day of your period. Everybody's periods can be a little bit different, but for most people, that's when it can happen. And working to maintain and improve your health before pregnancy can also increases your chances of getting pregnant and decrease any pregnancy complications once you actually do become pregnant. These recommendations can help prepare your body for pregnancy and give you a better chance of having a healthy baby. So you should see your doctor. So before you get pregnant, talk to your doctor about any preconception health care. Your doctor can check your baseline blood pressure, if you have anemia, diabetes, any other conditions that could affect your pregnancy, and that way you can start getting treatment for those. Your provider should also discuss with you your health history, any medical conditions that you currently have, if you've been pregnant before, any problems that you had in that pregnancy, any medications that you're currently taking. They can tell you vaccinations you might need, and then any steps that you can take before pregnancy to prevent certain birth defects, because some can be linked to things like not getting enough of a certain nutrient in our diet. And so just making sure that we're getting all of that. So be sure that you talk to your doctor, even if they don't ask, make sure you're open about any medical conditions you have, and be honest with your doctor about any lifestyle or behavioral things that you have. It's important to talk to them. Let them know if you smoke, if you drink alcohol. Let them know if you live in a stressful or dangerous environment. It's really common that when you go to the doctor that they have questions like this on their intake, or maybe the nurse or the medical assistant asks when you go in for your appointment. Don't just lie to them, be honest. They really don't care about, if you smoke or drink, whatever, but they just want to give you the best information, but also help you and give you the best care that you can get. So both partners should schedule a checkup with their doctor or midwife before trying to conceive a baby. And there are things that both the male and female partner can do to maximize the opportunity of getting pregnant, especially if you've been trying for a while and you're haven't been successful in having a pregnancy. Definitely, it's recommended that both partners would go in for a checkup. So what can you do? Try to maintain or work towards a healthy weight for you. They've actually found that people who are overweight or obese actually have a higher risk for many serious conditions, including complications during pregnancy. So, heart disease, type 2 diabetes, certain cancers like endometrial cancer, breast cancer, colon cancer. People who are underweight, so the opposite, we don't just have to be overweight, but if you're underweight, or you can also be at a risk for serious health problems. So if you are either underweight, overweight, or obese, talk to your doctor about right ways to reach and maintain a healthy weight before you get pregnant. And this might include speaking with like a registered dietitian who can help give you individualized advice on what you may should be eating or maybe shouldn't be eating. So talk to your doctor also about what the right weight is for you. Maybe you don't know. They can help you figure that out. A lot of times it's based on our height, but there's also some things that can influence it, like our activity levels, how much muscle mass we have, and all of that. So talk to them about what the right weight is for you and how that weight can be maintained or achieved in a healthy manner before getting pregnant. Mothers who are either underweight or overweight prior to becoming pregnant could experience health problems like having premature birth, birth defects, having gestational diabetes, which is essentially just diabetes in pregnancy, or high blood pressure. One of the ways that we can help with this, not only maintain our weight, but lots of other functions of our body, would be to get regular, moderate exercise. So that would be about 2.5 hours per week of moderate intensity aerobic activity. This doesn't mean that you need to go run for 2.5 hours or ride a bike for 2.5 hours, but things like brisk walking, just something that gets your heart rate up a little bit, that might be walking your dog around the block, can be recommended before and during pregnancy unless there's some medical reason that you've been advised to avoid physical activity. Um, if we do a little bit higher intensity exercise, that number goes down. So we don't necessarily need 2.5 hours. But if we're just doing a moderate intensity, that's what's recommended. It's also important to limit or avoid harmful substances. So try to avoid as best you can harmful chemicals, environmental contaminants, and any other toxic substances like synthetic chemicals, metals, fertilizer, bug spray, cat and rodent feces around the house and in the workplace. So if you have like a cat, maybe have your partner or somebody else that lives in your house emptying the litter box, and make sure that we're putting out any, rodent traps and things like that so that we can manage that. Any of these substances can hurt the reproductive systems of both men and women. So kind of back to what we were talking about earlier, that it may be the male or the female that can be part of the issue when we're trying to conceive. So exposure to even small amounts of these substances during pregnancy, infancy, childhood, or puberty can lead to diseases. And so we want to make sure we're avoiding them as best as possible. And then lastly, start taking vitamins and supplements. Certain vitamins and supplements like folic acid are recommended to take during the time that you're trying to conceive, and throughout your pregnancy. So it's really common that we find out we're pregnant, we start taking prenatal vitamins, but you can also start taking those while you're trying to conceive so that we can make sure we have a healthy baby. You don't necessarily have to, but it can definitely help. Folic acid is a really important vitamin and it's a B vitamin. If a woman has enough folic acid in her body at least 1 month before and during pregnancy, it can help prevent a lot of major birth defects of the brain, of the baby's brain and spinal cord. So it's really important for the development of those things. Now, while you're pregnant, let's talk a little bit about the amount of weight that you gain. So, the amount of weight you gain during pregnancy is important for the health of your pregnancy and for the long term health of you and your baby. So, gaining less than the recommended amount of weight in pregnancy can be associated with delivering a baby who's too small. Some babies born too small might have difficulty starting breastfeeding. They can be at increased risk for developing illness, and they might even have developmental delays, which is not meeting the milestones for his or her age. So there's a lot of milestones out there. Walking by 1-year-old is one of them, but there's a lot of what we call motor, so movement, and then also the developmental milestones where they're saying so many words by a certain amount age and all of that. So gaining more than the recommended amount of weight in pregnancy. So the opposite hand of that can be associated with having a baby who's too large, which this can lead to delivery complications, cesarean delivery, and even obesity during childhood. Gaining more than the recommended amount of weight can also increase the amount of weight you hold on to after pregnancy, which can lead to obesity. So you might be thinking to yourself, what is the appropriate amount of weight that I should gain during pregnancy? The typical guidance for a healthy pregnancy is to gain somewhere between 25 and 35 pounds, which is about the weight of the baby, the placenta, the fluids, and all of that that is basically growing in our uterus. So the appropriate weight gain would be different for person to person. Talk to your provider about a healthy range that you should gain, but on the average, that 25 to 35 pounds is what we're looking for. Taking prenatal vitamins and other supplements as recommended by your provider can help us stay within that right amount. It's also important during pregnancy to eat a nutritious diet. This can be linked to good brain development of the baby and a healthy birth weight, and it can reduce the risk of many birth defects. So, a balanced diet will also not only help the development of the baby, but it can reduce the risks of having anemia and other unpleasant pregnancy related symptoms like fatigue and morning sickness. While you're pregnant, you should be sure to avoid toxins like alcohol, drugs, and tobacco. These can definitely harm the baby's development. During pregnancy, you should eat a balanced diet that includes fruits, vegetables, whole grains, proteins. Talk with your doctor about what foods or drinks you should avoid or limit during pregnancy. But like I said earlier, it can be a great resource to have your doctor refer you to a registered dietitian because that's what they specialize in, and they can definitely give you very individualized and help you kind of plan meals that are something you would eat. We could have the perfect meal plan with the most healthy foods out there, but if we're not actually going to eat it because we don't like those foods, that's also not helpful. So, a registered dietitian can be a great resource for finding healthy but foods that you're going to eat. So, while pregnant, you want to make sure that you're continuing to exercise. We already talked about why we want to exercise pre pregnancy, but we want to make sure we do it in pregnancy too. Pregnancy might seem like the perfect time to sit back and relax, and it's common that people think they can't exercise once they become pregnant, but that's actually not true. They've done a lot of research, and exercise can actually help things. So while you're pregnant, you're likely going to feel more tired than usual. Your back might ache from carrying around extra weight, especially as we get farther along into our second or third trimester. But unless you're experiencing complications, sitting around typically does not help. And I often see patients in the clinic who this actually gives them more pain later in their pregnancy. So I have a lot of people who either in their first trimester they were very sick and so they just didn't have the energy to exercise, or maybe they were put on bed rest for some reason. They tend to get much weaker, their endurance goes down. So once they're able to get up and move around, they're spending time trying to catch up and they end up getting a lot of pain, a lot of pelvic girdle pain, pain right in the front in their crotch. They're getting kind of that lightning crotch or the groin pain. And so being active can help us prevent that. So pregnancy can actually be a good time to start getting active, even if you haven't exercised in a while. Now, this doesn't mean that this is a good time to, I've never been a runner and now I'm going to run a marathon. Or if you haven't been lifting heavy weights like CrossFit or powerlifting, pregnancy is probably not the best time to start that, but it could be good to start a low intensity exercise routine. This is because regular exercise during pregnancy can actually reduce things like backaches, constipation. It can help us with bloating and swelling because of the circulation. And then it can also help boost our mood, energy levels, and it can even help us sleep better in certain instances. That's not saying that you're going to go to sleep in your third trimester and not wake up at all just because you went to the gym that day, but it can definitely help. Some of the other benefits of regular exercise during pregnancy is a lower risk for having things like gestational diabetes, and then even the potential for a shortened labor. They've actually done research that people who exercise, people who do yoga in the prenatal period, on average, have a shorter labor than those individuals who don't. So if you exercised prior to getting pregnant, you can continue pretty much anything that you are doing. You might need to make some modifications, listen to your body. But just because you're pregnant doesn't mean you need to stop lifting weights or doesn't mean you need to stop running or doing anything that you like to do. Good options, though, if you're looking for things to get started with, would be a prenatal yoga class. Walking can be great, swimming can be great. If you're not sure, talk with your doctor about what activities are safe for you and what should be avoided or what should be modified. Another thing that can be helpful is practicing mindfulness. and managing your stress. Feeling stressed is common during pregnancy, partly because there's just a lot of changes. Not only are there hormonal changes and physical changes of your body, but a lot of times there's just lifetime changes. And so these changes can be great, but they also can add a lot of stress to our life. High levels of stress that continue for a long time can actually lead to health problems like high blood pressure and heart disease. So during pregnancy, stress can increase the chances of having premature baby or premature delivery, and even a low birth weight of the baby, which increases the risk of other health problems. So, to support wellness, you can do meditation, breath work, learning how to pay attention to how you breathe and just how often you breathe, and noticing the environment around you and how you're feeling. Journaling can also be a great practice, and then yoga and any kind of mindfulness exercise. One of the things that I see a lot in the clinic is people who, one, don't know how to breathe, but two, they don't breathe a lot. They catch themselves throughout the day when they're stressed holding their breath, or they're doing something strenuous and they're holding their breath. Make sure you're breathing with everything that you do. If you are doing deep breathing for a meditation or a mindfulness practice, another thing that can be really helpful is doing diaphragm breathing. So, this is something that I often teach in the clinic. And a simple way to do diaphragm breathing is to put one hand on your stomach and one hand on your chest. When you take a deep breath in, when we're using our diaphragm, what we should see is that hand on our stomach actually rises a little bit because our stomach is filling up with that air, or the diaphragm is pushing down, which makes it looks like our stomach is filling up with air. What I commonly see when we try to take a deep breath in the clinic is somebody puts their hand on their chest and they take a deep breath in, and all of that breath goes into their chest, but nothing happens with their diaphragm and their stomach. So practice hand on your chest, stay still when you take a breath in, and really use that diaphragm. This can help us to stimulate what's called our vagus nerve, and that helps us get into the rest and digest phase of our nervous system and get out of that fight or flight where we're stressed, we have lots of hormones, and we have a lot of adrenaline running. We don't want adrenaline to be there all the time. Another thing that's important that I don't think we think about a lot is to make sure we see a dentist when we're pregnant. Being pregnant will increase your risk for oral health problems or anything in the mouth. And these problems can actually affect your pregnancy. So, for example, some studies actually show a link between gum disease and premature birth. Premature birth is birth that happens too early, and that's typically anywhere before 37 weeks of pregnancy. Premature babies often have more health problems at birth and also later in life than babies who are born at full term. Taking good care of your mouth, your teeth, your gums during pregnancy can help to have a healthy pregnancy and a healthy baby. There's obviously a lot of things that go into that, but that's one of the keys and something that I think we forget about a lot. Um, So before childbirth, now we're pregnant. We were preparing for pregnancy earlier. Now we were pregnant. Now we're getting to the end. So preparing for childbirth can help you give or help give you an understanding of your options. So one of the great things that you can do is to take a childbirth class. In childbirth classes, you and your birth partner can learn about the different stages of the birth process, different pain relief options, how to handle pain, different birthing positions, breastfeeding, and newborn care. A lot of places will do like a series of classes. It might not just be one, 1 hour birth class or one webinar like we're doing right now, but understanding what's actually happening in the labor and delivery process can help you just understand what's going on and kind of know what to expect. We find that when people go into labor and they don't really know anything aside from, I'm going to deliver this baby, they tend to have a much lower satisfaction, I guess, with their birthing process. They're more likely to have other issues than other people who go in actually knowing what's going on. That doesn't mean we expect you to be a labor and delivery nurse and or an obstetrician and be able to deliver a baby, or a midwife, a doula, anything like that. But just having a general idea of what to expect. A few types of birth classes are Lamaze classes, Bradley, and hypnobirthing. Your hospital or birthing center may also offer birth classes of their own, and these can be great to attend because that's who's going to be helping you deliver the baby, and so they can give you the best idea of what to expect. Depending on the duration of the class, it's usually best for the parent and their birth partner to take a birth class during the second or third trimester. Partly too, because if I take a class, when I first find out I'm pregnant, I might have forgotten a lot of stuff. There's a lot of time in pregnancy, and you want that information to kind of be fresh in your brain. Another thing to talk about is how you intend to feed your child. So, if you're welcoming a new baby, you're going to have some decisions to make about how to feed them. Thinking about this before labor and delivery can reduce the stress of having to make that decision while you're recovering from labor and delivery, but also while the baby is already there. It can be a very rewarding, but also a very stressful and sleep deprived time once you deliver. Kind of making that decision beforehand can definitely help. With birth plans too, it's good to prepare those. A birth plan is essentially just an outline of what you want for delivery. This plan will help your doctor or midwife, any nurses, and support people around you understand what your personal wishes are. You should talk about your plan with your support person and your doctor or midwife. Not only will it help them understand you, but it will also help you figure out if what you have in mind is actually feasible and safe for your baby. If you My biggest recommendation is if you are talking about your birth plan with your healthcare provider, and they can't give you a reason why they don't think that that's feasible and safe, you might want to just explore other options. I think your birth provider should listen to you. There are some instances where safety is an issue, but if they can't give you a reason why, or they just suggest something or don't want to do something for the convenience of it, that's not a good sign. And then, with that said, while many parents have an ideal birth plan, it's important to remember that things happen during the birth process that may or may not be anticipated, and they may or may not be in your control or your healthcare provider's control. So, for example, the baby might arrive early, they might get into an awkward position where maybe they have shoulder dystocia and their shoulder is getting stuck. Maybe they're breached. You might have your blood pressure get really high or get really low. And this can happen to anyone. It's not anybody's fault, but just be prepared that your birth plan may not go exactly as planned. Same thing with feeding. You may have a plan of how you want to feed your baby postpartum. Have that plan, but don't have your heart set on it. Be okay with things changing at least a little bit. One thing that can be great with all of this is finding a doula. So, a birth doula is trained to provide continuous one on one care and support to a birthing person and their birth partner. The doula's aim is to help parents have a safe, memorable, and empowering birth experience by providing physical comfort, emotional reassurance. They can give you information, support, and help you advocate for yourself. So maybe something isn't going according to plan, or your provider doesn't want to do something in your birth plan. They can help you advocate for that and help you make the best decision for yourself with that information. Having a doula has actually been shown with research to decrease the rate of having a C section, decrease how long you're laboring, and even lower the need to use pain relief medications during delivery. And then lastly, before childbirth, you want to get ready. So you want to pack your bag for getting ready for that trip to the birthing location, wherever that might be. Um, and that's going to help reduce the stress once you actually go into labor. Once you go into labor, that's not really the time when you want to be thinking about what you want to pack to go to the hospital or to the birth center. And some things that you might want to think about packing would be your birth plan, any loose, comfortable clothes, breast pads. You can bring toiletries. You can bring shampoo and conditioner, soap, deodorant, a hairbrush, hair ties, chapstick, any healthy snacks in a water bottle, sleepers for the baby swaddling blankets, diapers and wipes, and then don't forget about the car seat. There's a lot of great resources on the internet about all of these different things. Lots of checklists on Pinterest or reels on Instagram about what you should pack. in your bag. All right. So before we leave today, so that was kind of the three things that we wanted to talk about. I want you to just take a moment and see if you can identify at least one person that you'll reach out to if you have questions or you need assistance with any of those three things. So, preparing for conception, while you're pregnant, and preparing for the delivery. So, just kind of have somebody or a resource in the back of your mind so that when things get stressful, you kind of already know who you're going to go to. And so, with that said, here's a list of resources available. So, we talked about doulas. They don't just help in the labor and delivery phase, but they can help throughout the stage of pregnancy and even postpartum. So, here's a link to some of the doulas in our area. The Doulas of Orange County actually serves all of Southern California, including San Bernardino County. So, you don't have to be in Orange County, and they can connect you with a birth or postpartum doula. They can also help with sleep training and lactation consultants, and they even provide virtual doula services. The Sankofa Birth Workers of the Inland Empire is made up of birth workers from many professional backgrounds and skill sets. The collective includes midwives, certified doulas, lactation consultants, community advocates, and other supporters. They're really committed to providing a high level of service while centering birthing families in a position of agency throughout the perinatal and postpartum experiences. And then lastly, the Doula Access Program. This is a collaboration between IHP and the Riverside Community Health Foundation, and they're trying to provide current pregnant IHP members with doula support services during pregnancy, labor and birth, and the postpartum period. This is actually a free service to all IHP members who live in Riverside or San Bernardino County. So if you have IHP, finding a doula for you is actually going to be covered at no cost typically. So those are some great resources for you. So thank you for spending some time with me late on your Wednesday night. Um, like I said, this presentation was developed in partnership with the Maternal Health Network of San Bernardino County. Here's a link to their website. They actually have some great resources. Um, and they have an Instagram page too where they post a lot of those resources. You're also welcome to reach out to me either via my website. You can email me. It's emily@wingspt.com, or you can find us on Instagram at Wings Physio HD. So that is all we have for tonight. Does anybody have any questions? And this is going to be uploaded to YouTube also. So if you watching after the fact and you have questions, you're more than welcome to drop them in the comments below, and we will answer them. But otherwise, I hope everybody has a great night.